if you've got a dog who regularly needs their anal glands expressed, then one of the big causes is that they have soft stools all the time. So what exactly can you do to prevent this being a problem, to solidify their stools and to stop their anal glands needing to be expressed? And then my final question is from Stacey, who says that her dog's anal glands have had to be expressed for about a year, anywhere from monthly to every 8 weeks, 8 to 10 weeks. And her dog is still having cow pat poops. Should she increase the fibre in the diet? She eats a variety of things with kibble, some treats with carrots and some greeny teeth brushing treats. And also she's a Lhasa Terrier mix. So anal glands, they can become impacted repeatedly for several different reasons. So loose stools certainly is one, and is probably the most common one, certainly in my experience. You can also get blocked tubes, so the tube that leads from the anal sacs to the outside world, then they can become blocked. And that can be because there are deposits actually within the tube, or there is inflammation kind of around the anal area that's compressing the tubes, making them more narrow and making them more likely to be blocked. And then finally, you can also get breed problems that just mean the tubes maybe are coming out kind of wrong, or they're a little bit kind of higgledy-piggledy, a bit wiggly, and again narrow and causing problems there. So those are the big reasons that we can get anal gland impaction and need really frequent expression like Stacey's dog is needing. Now, persistent loose stools is a completely separate topic. That can be due to a number of different reasons. There's quite a lot of them. So we can have a food intolerance, we can have parasites, we can have various infections like giardia, we can get inflammatory bowel disease where the guts just aren't working properly. There are also hormonal problems can cause just a chronic diarrhea, and we could get organ disease such as exocrine pancreatic insufficiency, where the pancreas just isn't producing enough digestive enzymes, and so we get a kind of a watery, sloppy cow patty type poop, which is what this dog's got. So really we need to try and find out exactly why this dog's stools are abnormal. Why are they like cow pats? Because that's not normal for any length of time. It might be, you know, in your dog that they have a little bit of a tummy upset, they get into something that they shouldn't have eaten, it tasted or it smelt nice at the time, but it causes a little bit of a tummy upset. But really, if the stools are loose for more than kind of a week or two, that suggests that there is an underlying problem that's going to need more treatment than just time. Now, getting to the bottom of the problem can sometimes be quite challenging, and it can be a bit of a longer process as you work through a number of different either tests or different treatment trials. And you know, looking into it further can involve taking stool samples, can involve trying different diets. If we're changing diets, we really need to give that a chance to work, and so we're going to need to feed those for about 6 to 8 weeks before we change to a different diet and we say that that one hasn't worked. We can give parasite treatments, we can take blood tests, we can do imaging with x-rays and ultrasound. So you can see there's a whole load of different things. And even in the case of inflammatory bowel disease, it might be that we end up needing to take biopsies of the intestine or having endoscopy to have a little look at what the lining of the intestines is looking like. So, that's a whole different category, and like you can imagine, it can take a long time, and sometimes costs can add up. In the majority of cases, of course, we're not going to have to do any of this at all. It's going to be, relatively quick and straightforward, but there's the warning that it might not be. Now, adding fibre can absolutely help to improve stool consistency, again, depending on the cause. So fibre is really important for the colonocytes, so the cells that line the colon, so they require that to get their nutrition directly from the contents within the intestine. So adding fibre absolutely can help, and that can be by adding pumpkin, canned pumpkin, bran, or Metamucil or something like that. But absolutely, you should talk to your vet to discuss this before changing diet, before adding anything to the diet, because it isn't going to be appropriate in every single dog. If you're going to get your dog's anal glands expressed every, anywhere from 4 to 8 weeks, you're going to be there relatively soon, so you can have that chat, discuss what it is you need to do, what the next step is. Your vet will also, or should also, examine the dog in general, have a feel of their belly, listen to their heart, take a history just to make sure that there's no other problems going on. Is there vomiting going on? Is there actually weight loss as well? Is the dog drinking more or urinating more? Because all of these things might give clues to help guide what the next step is. Now, the next thing to say is that regular expression while we're going through the investigation and treatment trials is clearly something that is going to need to be kept up, because the last thing we want to develop is an abscess. So if the anal glands get really full and they're not expressed in time, they're going to start to become irritating, which is why dogs will scoot their bum along the ground or while they start chewing their back end. But also the contents will dry out and they'll become infected, and then they can actually burst and form really painful abscesses that then burst out through the skin kind of around the back end of a dog. So we don't want that to happen. We need to make sure that that regular expression is maintained. And also if we're expressing it regularly, then generally it's a very simple job. When the contents dries out or they become infected, sometimes it can actually be quite challenging to express them. By that time they're painful already, so that's another thing that goes against the ease of expression. And sometimes we'll need to actually sedate a dog so that we can express them and flush them properly. So the bottom line is if you've got a dog, or if you've got a dog with any problem, it might be that that problem is actually the result of another issue that needs to be investigated. So in this case, the anal glands are not being expressed naturally because the stool's loose, and so we need to look at why the stool's loose. It's a little bit like, say, with skin disease. If you've got a dog who's itchy, well, that itching isn't the actual main cause. The problem might be that they've got an allergy, and so you need to tackle that allergy. So, there's a few ideas there, but in the vast majority of cases, a few simple changes will be all that's needed to make sure that that anal gland expression isn't needed on a consistent basis.